Hello everyone, Medical Level Up here, and we're back again with another playlist. This playlist is going to be about dysrhythmias, mainly tachydysrhythmias and bradydysrhythmias. We're going to classify both of these, and then we're going to break the playlist down into separate videos for each particular rhythm. At most, one video is going to discuss either 1, 2 or 3 tachydysrhythmias or bradydysrhythmias. At the end of each video, I will try to put in as many examples as I can, and I will interpret the examples with you as well. I would also recommend that before starting watching this playlist, I would recommend you watch the other playlist where I talk about the basics of an ECG, and then another playlist in which I interpret the ECGs with you so you can get practice. Remember, practice makes perfect, so it's really dependent on how many ECGs you see, which will polish your skills on reading an ECG better. Bear in mind that this playlist is not about how you manage a particular rhythm, as in, for example, if you want to give atrial fibrillation, beta blockers, calcium channel blockers, or any antiarrhythmic medication. This playlist is going to focus more on the identification of the rhythm on an ECG strip. Now, there are going to be certain situations in which you will need more clinical information from the patient. For example, when you are differentiating between an SVT with aberrancy versus a ventricular tachycardia, you need the information whether the patient has a diseased heart or not, whether the patient is a young patient or an elderly patient. That can make or break the diagnosis. But we are not going to be covering that, and we are going to be strictly focusing on the rhythm identification on the ECG strip. We are not going to be talking about the management of these. As always, I would really appreciate your feedback for these videos in the comments section below, so we can improve these videos and make the future videos better for you guys and more useful for you guys. Alright, without further ado, let's get started.